Welcome to the About the Face podcast, sponsored by the American Academy of Facial Plastic and Reconstructive Surgery through the Facial Plastic Surgery and Aesthetic Medicine Journal.
Hi, my name is Harry Chiang. I am an otolaryngology resident at Duke University Hospital. I'd like to share my work with Dr. Dennis Frank-Ito titled Comparing Patient-Reported Outcomes to Computational Fluid Dynamics-Derived Nasal Airflow After Nasal Airway Surgery, Prioritizing the Patient's Perception of Nasal Obstruction. Nasal airway obstruction is a common problem that dramatically affects quality of life. There are well-established surgical procedures to improve nasal patency for patients suffering from nasal airway obstruction, but a small percentage of patients continue to experience symptoms postoperatively. In some cases, patients report no symptomatic change despite improvement on objective metrics, and the correlation between subjective and objective assessments remains unclear. We set out to use a technique called computational fluid dynamics modeling to study nasal airflow patterns in detail using high-resolution patient-specific CT images with the goal of better understanding these discrepancies compared to subjective surveys. These include outcome surveys such as the NOSE, Nasal Obstruction Symptom Evaluation, and VAS, Visual Analog Scale. We found that among patients who underwent nasal airway surgery, it was the postoperative state of the initially more affected or bothersome side that drove outcome perception. In contrast, the degree of symmetry in nasal airflow between the two sides of the nose did not play as large a role. Based on these findings, surgeons should prioritize improving the affected nasal side even if it narrows the contralateral side, rather than necessarily seeking to achieve symmetry. These insights are important for a future where surgery is increasingly based on pre-surgical planning to optimize outcomes with individualized surgical technique for each patient.
We'd like to thank the authors for their commentary and thank you for listening to our podcast. If you'd like to explore more, please feel free to check out the article in print at the Facial Plastic Surgery and Aesthetic Medicine Journal or online. We'll catch you on the next one.